Hello everyone, my name is Ewube Gloria, a nursing student and a holder of the higher national diploma. Today I'm going to be taking poll for pediatric pathologies, and I'm going to be taking the most common pediatric pathology, pneumonia. So our outline is going to be running from the definition to the pathophysiology to the causes, the risk factors, the signs and symptoms, diagnosis, treatment, nursing management / intervention, and the prevention. So let's get to it. Before we start, we need to know that the aim of this video is to make us to have a better and a simpler understanding about these conditions, and this video is open for any contributions, and the aim is to make us to learn easily and briefly. Going to the definition of pneumonia. Pneumonia is an inflammatory lung disease that causes the lungs, the air sacs of the lungs, known as the alveoli, to be filled with fluid or pus. Moving to the pathophysiology of this disease can be caused due to an inflammatory response. What do we mean by it? In a case where we have harmful microorganisms which enter into the child's system due to the fact that children's immune system are less resistant to infection than adults or older people of age. So in this case, white blood cells now are produced in the system to fight against these harmful microorganisms or infection. This causes them to encapsulate or engulf these microorganisms, causing accumulation of these capsules, and which might go and sit in the organ which we are concerned about, the lungs, and might cause the fluid or the pus in the alveoli. For the causes, pneumonia has various causes. It can be caused by bacterial infection, it can be caused by viral infections, it can be caused by fungal infections, and it can also be caused by aspiration. That is the ingestion of food particles that do not go into the digestive tract but rather in the respiratory tract. It can also be caused by inhalation of irritants like dust, pollen, smoke. For bacterial infections, we have different species of bacteria which can cause pneumonia. Some of them are, we have the Streptococcus pneumoniae, we have Haemophilus influenza, which can be prevented by the Haemophilus vaccine. We have Streptococcus aureus, and we have also, for the viruses, we have the influenza virus, we also have the adenovirus, and we have some other species of fungi which can cause pneumonia. For the risk factors of pneumonia, we have as primary risk factor age. Mind you that this disease is more prevalent in younger children than older children, younger pediatric children than older children, and it is more prevalent in children than in adults. So age is a risk factor for this condition. Other risk factors include family history of this condition. If the child has maybe a family member that has this condition, this child might tend to have the condition. We also have race as a risk factor, as this condition is more prevalent in blacks than in other races. Moving to the signs and symptoms of pneumonia. Pneumonia has very common signs and symptoms which can be found in every child, like fever and chills, difficulty in breathing, wheezing breath sounds. When the child is breathing, you hear some abnormal sounds in the chest. You have also other signs like nausea and vomiting, loss of appetite, and all. Now, how can this disease condition be diagnosed? It can be diagnosed in various different ways. We have biomedical history, that is trying to find out if this child has had any symptoms like this in the past or it is the first time, and that will determine if it is an acute reaction of the disease, that is acute pneumonia, or is this chronic, that is it has been happening before. We also have physical examination like auscultation of the chest to listen for abnormal breath sounds. We can also use imaging techniques like X-ray, which will show the chest, image of the chest, to see if there are any fluid filled in the lungs. We also have PCR, which is protein Sorry, we have the PCR test, which is known as the polymerase chain reaction test. It is used to detect any virus or any genetic information from a specific organism. We have also blood tests like CBC, full, also known as full blood count, which can reveal the level of white blood cells, and if it shows an abnormally high level of white blood cells, it could show that this individual has infection or the body is trying to fight against something foreign in its own body. That is why it has an abnormally high level of white blood cells. Other diagnostic tests which can be used are urine tests. You can also use sputum culture, where culture is going to be done on the child's expectoration, that is a sputum of the child, to specific species of the microorganism, be it a bacteria, a virus, or a fungi, to know the specific species and to also to be specific with the treatment. Talking about treatment, let's move to the treatment. The treatments that can be given in this condition, we have antibiotics, we have antivirals, we have antifungals, depending on the cause of the disease. We also have antipyretics in case of any fever, and we have analgesic in case of pain, especially chest congestion, as one of the signs and symptoms of the disease. Moving to the nursing management. For the nursing management as nursing intervention of this disease, first, what we as nurses are required to do or are advised to do primarily when we receive a patient is to monitor the vital signs. Why is this always preferred to be done first? This is so as to have a baseline data for the patient, so as to be able to monitor the patient properly and know if the patient is getting better or the patient's condition is deteriorating. Secondly, for the nursing intervention / management, we have to secure an IV line. This will be able to ease the passage or the administration of the medications prescribed by the doctor parenterally, as this is the fastest route for drug action. We also have oxygen therapy. This is the child is going to be put on oxygen so as to help ease the breathing pattern of this child and make breathing easier and less stressful. We can also monitor the intake and the output of fluids of the child and encouraging the child to be taking fluids. This is because taking fluids is going to enable to thin the secretions that are going to be produced at the level of the lower tract, the lower respiratory tract, that is the chest. That is, it will reduce the viscosity of the secretions, making it easier for them to be expirated or spit out. And then also, we are going to be putting this child in a comfortable position that will help enhance the breathing pattern of the child. Will also make the child comfortable enough so as to be able to take care of this patient appropriately. The best position that will be favorable for this child will be the semi-fowler or sitting position. This is because this position helps to open up the airways and to make breathing easier and less strained. Moving now to the prevention of this disease. This disease can be prevented by first getting the child vaccinated. As we all know, there is HIV vaccine, that is the vaccine against Haemophilus influenzae, which is one of the causative agents of pneumonia. So if these children or if these pediatric patients follow their vaccinations properly, they might tend not to have this disease condition. Also, good hygiene measures should be put in place. That is, keeping the child's environment clean, always washing hands when maybe breastfeeding the child and other things. Next, we encourage the caregivers of this child to give the child more fluids, as this will help open up the airways, thinning the secretions, and also keep the child hydrated. As another prevention, avoid exposing this child to cold, as this is going to make the child to have stuffy nose, and due to that can cause respiratory distress. avoiding putting the child in overcrowded areas, in areas that are more prone to irritants like smoking areas like local kitchens, putting them in cool environments, exposing them to cold, especially in the rainy season. Keeping the child warm is also another prevention which will help the child to not only keep the basal body temperature but also avoid other complications aside pneumonia. In conclusion to this, pneumonia is a disease condition which is mostly seen as a non-life-threatening or a condition that can easily be treated. But if not properly taken care of, or if measures are not taken, this condition might deteriorate and complications might set in which can be fatal to the child. Complications such as COPD, which is chronic obstructive pulmonary disease, may cause respiratory distresses and other lung problems. Other complications like hypoxia, central cyanosis, which will cause bluish discoloration of the lips and the fingertips, which is a sign of hypoxia, that is, the tissues are deprived of oxygen. It can also lead to blackouts of the child, as respiratory distresses are going to cause lack of oxygen climbing to the brain and so causing the child to pass out. And it can also cause lung abscesses and many more. So we are all advised to have a good knowledge about this disease and to be able to prevent it so as to avoid complications and avoid spending money. My name is Ewube Gloria. Thank you for watching this video, and I take to precise that this video is just for learning purposes. It is open to contributions. It's to make learning easier and more interactive. Thank you very much.